So again, thank you for having me. Just to give you a bit of background, in our Master of Public Health program at Michigan State, I teach our course on public health program evaluation. And our students include part-time and full-time professionals who work in the field of health and are interested in learning more about how to assess the quality and potential impacts of public health interventions that are part of their work. So some of the strategies I'll be sharing today, we also cover in that course. This workshop is obviously a super condensed version of what we cover, but I'm hoping it still provides a helpful high-level overview of how to get started in evaluating public health programs and programs more broadly, because I realize that not all of you are necessarily engaged in public health work, which is fine. The information I'll be sharing today should still be applicable to your work. And so I hope that you come away from this session able to define program evaluation, describe different types of evaluation. We'll be focusing on process and outcomes evaluations more specifically today. Be able to describe the general steps in conducting a program evaluation. And finally, describe different data collection methods that you might use in program evaluation, including surveys. So just to get us started, I really like this cartoon and how it illustrates what often happens in the beginning of an evaluation. So as we see, the person on the left says, "I know our program works." Well, the person on the right, who is presumably the evaluator, says, "No, you don't." You know, when you're immersed in a program and have invested a lot of time and resources in its conception, development and implementation, it's understandable that you might be convinced of its benefits, you know, that it works as you intended to. Maybe you observe program participants responding favorably to it, or they actually share with you how the program has positively impacted them, which in your mind might be evidence enough that it works. And, you know, not to discredit or negate these observations of how a program is working, because they're certainly valid and important and are, you know, should be included as part of an evaluation. You're obviously, you know, on the front lines of the program, but there is a need to conduct an evaluation that's a bit more objective, just so that findings are useful and accurate and can give us a bit more certainty as to whether a program works as intended or doesn't, while also understanding that you or maybe the program developers you're working with are eager to demonstrate the benefits of their program and that it's worthy of continued funding. So I've used the terms program and program evaluation a few times. So I just wanted to take a moment to define them. So when I say program, I'm referring to a structured intervention to improve the well-being of people, groups, organizations, or communities. Programs vary in scope, duration, and clarity and specificity of goals. Just to give an example, many of you, myself included, probably participated in some after-school program when you were younger. Maybe you were on a sports team or participated in an academic club or a mentoring program like Big Brothers Big Sisters. Unlike unstructured activities like hanging out with your friends after school, these activities have, you know, a clearly defined structure. They're often delivered in supervised spaces and include specific goals. So just to give you an example of what I mean by program. And then program evaluation refers to a systematic method for collecting, analyzing, and using data to examine the effectiveness and efficiency of programs and to contribute to continuous program improvement. Can anyone guess the key word in this sentence? Do you just want to call it out?
Would it be effectiveness?
That's an important word, but not quite the one I was looking for.
Systematic?
Systematic.
Yep, systematic, exactly. So evaluation, you know, involves using a clearly defined and organized method There's a structure in place. You're not haphazardly coming up with questions that you put on a survey and ask miscellaneous people to complete. Instead, evaluation is purposeful and methodical. There are clearly defined questions that guide the process, including the data you collect, how you collect it, from whom and when, and how you analyze it. So what's the purpose of conducting an evaluation? Well, it can be used to determine the efficiency or effectiveness of a program. To clarify, program efficiency generally refers to the costs of generating program resources or services, where you're measuring the program outputs in relation to the inputs or what you put in. So you're assessing the program's economics, so to speak. Some of you may be familiar with cost benefit analysis, which we won't be covering really today, but just important to bear in mind as an option. And in comparison, assessing a program's effectiveness means you're measuring the program's effects in the target population. Another purpose of evaluation is to understand why a program may or may not be working. And we'll talk a little later about how process or implementation evaluation designs can help to shed light on how a program is operating and whether it's operating as the developers intended. And finally, findings from evaluations really can and should be used to improve programs. We're not just conducting evaluations for the sake of conducting them or to write up our findings for publication and have them sit in a journal, but to inform meaningful change and support continuous program improvement. So again, just to reiterate, the goal of evaluation is not simply to use the findings to add to the knowledge base, like in the case of research, but to strengthen program services. Lessons learned from evaluation can and really certainly should be published to share with others who are engaged in similar work. But again, the primary aim is to improve programs. So now let's turn to talking about two specific types of evaluation, which you might be familiar with. A process evaluation, which is sometimes referred to as an implementation evaluation, assesses how well a program is working, whether its activities are being implemented as intended, which we refer to as being implemented with fidelity, and whether it's reaching the desired population. These evaluations are also conducted as soon as a program is implemented and throughout its operation. And I would say that process evaluation has two primary purposes. So the first is really to gather data about the delivery of a program. We want to know that the program is actually being delivered and what services are provided and to whom. So then, for example, if we don't find any impacts of the program on participant outcomes, we can then go back to this implementation information and see where in the process the program might have broken down. Were there any trouble spots? And if so, how can they be fixed? And then I'd say the second general purpose of conducting a process evaluation is to collect detailed enough information about how the program was implemented so that if other groups or sites want to implement the program themselves, they have a detailed playbook, so to speak. So they know, what activities need to be implemented for how long and at what dosage or amount. And these are some examples of process evaluation questions you might ask. Did the program reach its desired target population? Were there any program services and activities? What were they? When and where did they take place? Were there any barriers or facilitators to providing those services or activities? And were participants satisfied with the services and activities of the program, which is a question that is commonly asked. And so again, the aim here is to gather more information about how a program is being implemented. In comparison, an outcome evaluation measures the degree to which a program has an effect on the target population. And it's conducted after the program has made contact with at least one person or group in the target population. I should clarify that when I use the term outcome, I'm referring to some observed characteristic of the target population, or maybe even a social condition that the program is expected to help change. So for instance, amount of smoking, body weight, attitudes about a particular health screening. So in other words, by outcome, we're referring to benefits that services have for participants. So not simply whether they received the services and were satisfied with them, but whether they actually benefited from them. So as evaluators, we want to determine what changes, namely what beneficial changes, occurred among recipients of a program and whether those changes can be uniquely attributed to the program as compared to something else. Did the program achieve its intended effects? And sometimes that can be difficult to tease out. Some example questions you might ask as part of an outcome evaluation include, was participation in the program associated with changes in participants' knowledge, attitudes, and skills? Did the program have any unintended effects on participants? And those can include positive, negative, or a combination of both types of effects. So I guess, how do you determine which outcomes to measure? Well, I think it's important to consider the outcomes that the program developers expect to see. What do they think the program is supposed to accomplish? And these expected program outcomes are often stated in a program's objectives or goals, maybe in a manual, or even in funding proposals and grant applications. They're also captured in a program's logic model. I understand that logic models were covered in a previous workshop for this group. And so coming up, we'll do a brief recap of the purpose and value they serve in program evaluation. But I would say for now, the key point to remember is that whereas process evaluation is focused on assessing aspects of program performance, outcome evaluation is focused on measuring the effects of a program. And actually, I should clarify, and say, an outcome evaluation is focused on measuring the potential effects of a program, because it's possible the program might not have any effects. So now why don't we pause for a moment and do a quick pop quiz based on what we just covered. So this statement is actually taken from a published journal article and describes an evaluation that the authors conducted. So based on the description, did they conduct a process or outcome evaluation? I'll read it. Older adult falls pose a growing burden on the US healthcare system. The Centers for Disease Control and Prevention's Stopping Elderly Accidents, Deaths, and Injuries, or STEADY initiative, was developed as a multifactorial approach to fall prevention that includes screening for fall risk, assessing for modifiable risk factors, and prescribing evidence-based interventions to reduce fall risk. The purpose of the study was to determine the impact of a STEADY initiative on medically treated falls within a large healthcare system in upstate New York. So based on that description, do you think the authors conducted a process or outcome evaluation?
Process.
Outcome.
Outcome. Okay, so this, I know it's a bit tricky. This is actually an outcome evaluation. And the giveaway was the last sentence where they say the purpose was to determine the impact of the initiative on falls specifically. And so here's actually the title of the study: Implementation of the Stopping Elderly Accidents, Deaths, and Injuries Initiative in Primary Care, an Outcome Evaluation. But actually, now that I look at the title, I could see how it's a bit confusing. The first word is implementation. Yeah, in this case, they conducted an outcome evaluation. What about this one? Active breaks in the classroom have been shown to be effective for increasing children's physical activity while simultaneously improving classroom behavior outcomes. However, there's limited evidence on the feasibility and fidelity of these programs outside of the research context. The purpose of the study was to conduct an evaluation to explore factors associated with feasibility and fidelity of a classroom active break. Active Break program designed to improve classroom behavior and physical activity outcomes for children in primary or elementary school years 3 and 4. So is this a process or outcome evaluation?
Process.
Yep, process. And here's the title.
I'm sorry, but I'm getting extremely confused with your
Sure.
definitions.
Okay.
Because you're using key words that say process to me. And then when I was thinking process, then you started using other keywords that kept saying outcome. So I'm not clear on how to tell the difference.
Okay, no, thank you for bringing that up, because if you have that question, others probably do as well. And it can be difficult, initially, and also, for more experienced evaluators to tell the difference. So process or implementation evaluation, again, aims to determine whether program activities have been implemented as intended or implemented with fidelity. And so like fidelity, is it feasibility and fidelity are key words in this description here that indicate it's a process implementation evaluation. Whereas with outcome evaluation, sometimes outcome evaluation is, you see it outcome effectiveness evaluation. That's focused on measuring program effects, by assessing outcomes or outcome objectives that the program is trying to achieve. Now, it is possible that an evaluation can also combine elements of both, a process implementation evaluation or an outcome effectiveness evaluation. So maybe as we go along, it will become a little clearer, but I can understand, why it's not always clear. And if anyone else too who has experience, with evaluation, wants to weigh in, feel free.
I think of it as the process evaluation is about how well you run the program. And the outcome evaluation is more about the effects of the program on the people that you're serving.
Yeah, I think that's
kind of how I
see
see the difference.
And I understand that part. The definition is not what's giving me a problem. What's giving me a problem is when I'm reading the examples that you're giving, and you're using keywords that could go either way. So I feel like I'm guessing which way you're gonna go. And I guess maybe we'll go along and maybe it'll become clear to me. Right now it's a very dense fog. It just does not make any, and I'm a layman in this area. So I don't have expertise in this area. I'm not used to giving evaluations and things, but I have to start learning the purpose of evaluations. And this right here, these two are very confused. The two examples you gave me confused me a lot because I went the wrong way both ways. And when you gave the right answer, I didn't understand why my answer was wrong. And I think that's what the problem is for me.
Okay. Yeah, no, thank you for sharing that. And maybe, it's possible these examples, aren't the best to give. And we would actually need to like pull up the studies and the articles and read through, the method and the purpose. There might be clearer language in there, that differentiates between the two. But yeah, I appreciate your raising those questions. And so I have a third example here. I don't know if it'll be helpful or cause confusion. I'm like tempted to just like skip over it maybe.
No, don't skip.
All right, so this one says limited evidence exists for intergenerational interventions to promote health and well-being in older adults and preschool children. We therefore aim to evaluate the implementation, feasibility, and influence of an intergenerational health promotion program based on psychomotor activity.
Now, this is process.
Yeah, you're right. So
that's very point blank. So that's the reason I understood that one. The other two, I guess, because I lack a certain amount of educational skills in this area that I was not able to decipher the other two, but this is very straightforward. So I didn't have a problem with this one.
Well, I mean, even in the other examples, I mean, I do have, some level of experience with evaluation. And as I read through them, just now, I even paused and realized how they could be confusing. So, I mean, that's helpful to know for the future. But so in this one, you're right. It's process evaluation and also outcomes. And the key words here are, when we look in the second or the last sentence, they're evaluating implementation and feasibility, which are, key words for process evaluation, and influence, which is the outcomes evaluation. So yeah, no, I appreciate your questions and feedback, and hopefully as we go along, it becomes clearer some of the key differences between process and outcome evaluations. And there are some helpful resources online too that I think probably do a better job of highlighting the differences between the two, and we can compile and make sure everyone gets those too. Okay. So now that we've gone through the different types of evaluation and what some example evaluation questions look like, how do we get started? What are the steps in the evaluation process? Well, I'd say regardless of the evaluation design you choose, regardless if it's a process evaluation or outcome evaluation, you'll essentially follow these steps, which are presented in the CDC framework for program evaluation in public health. Again, even if you're not in the field of public health, you can still consult this framework as a guide. So if we start at the top of the diagram, we begin an evaluation by engaging stakeholders, followed by describing the program we want to evaluate, focusing the evaluation design, gathering credible evidence, justifying conclusions, and ensuring that lessons learned are shared and used to improve the program. And we'll unpack each of these steps in the next few slides. But I just wanted to point out at the center of the diagram, we see standards for evaluation to help ensure quality. And so they include utility. Is this evaluation useful? Will it serve the needs of the people who will use the findings? Feasibility. Is the evaluation realistic in its approach, given available resources and your timeline? Propriety. So it's important to ensure that our evaluation activities like data collection are ethical and consider the welfare of those who are involved. And finally, accuracy, ensuring that an evaluation conveys accurate information that's free from bias. So these are just 4 standards to keep in mind when we conduct program evaluation to maintain the integrity and quality of our work. So often the first step in a program evaluation is to engage stakeholders. And by stakeholders, I'm referring to anyone who has a vested interest in the outcome of the evaluation, including program leadership, staff, families, maybe children, adolescents, service providers, and community leaders. So you want to be sure to consider the value systems, priorities, and perspectives of those who have a stake in what will be learned from an evaluation, and what will be done with the knowledge that's gained from the evaluation. And just ensure that you hear from a diverse group, including those who are involved in the operations of the program and those who will be directly served by it. They can provide you with input on evaluation questions to ask, as well as the measures you use, how you collect data, and how you interpret and present the findings. So establishing a community advisory board in the beginning of an evaluation that's actually a great strategy to engage stakeholders in designing an evaluation, and again, to ensure that diverse perspectives are represented and advocated. So a community advisory board serves essentially as the eyes and ears of the local community. So they're a group of individuals who are assembled to provide input on a particular project and can inform and guide the evaluation design and activities in partnership with the evaluator. The second step in the CDC's evaluation framework is to describe the program you'll be evaluating. What is its mission, goals, and objectives? What problem or need does it address? What services and resources does it provide? Who's the target population? What outcomes does it aim to impact? So you're essentially describing the who, what, and why of the program. And SMART program objectives can be helpful in establishing annual mileposts that the program needs to achieve to accomplish its goals. And so they provide important information about a program's aims. Just to take a step back, a program goal is a broader statement of what a program hopes to accomplish. For example, to improve students' mental health. And an objective is more concrete and breaks a goal down into smaller measurable parts. For example, to decrease the levels of depression and anxiety by 50% among high school students within 1 year of completing the program. So objectives more clearly and concisely convey a program's expectations. And I'll talk more about what SMART means, SMART objectives specifically on the next slide. Also to note, a program's logic model can help to synthesize the main program elements in a diagram of how the program is supposed to work. And it can be useful as well to refer to in describing a program. So hopefully you'll be evaluating a program that already has clearly defined goals and objectives and a logic model. If not, it'll be important to spend some time in the beginning generating this information with stakeholders. So what do I mean by SMART program objectives? There honestly could be a whole separate workshop just devoted to this topic, but I at least wanted to introduce it in case you're not familiar. So briefly, this acronym refers to objectives that are specific. So they're concrete, detailed, and well-defined. They convey the who and the what, what will change for whom. For example, to decrease the percentage of high school students who use drugs and alcohol. So the who and the what are captured there. SMART objectives are measurable and use numbers and quantities to provide, a means of measuring and comparing. So they capture how much change is expected. For example, to reduce the percentage of students who use drugs and alcohol by 50%. So the quantity is captured there. SMART objectives are achievable. In other words, they're feasible and they're easy to put into action. You can accomplish them in your proposed time frame with the resources and supports that you have available. An objective like to improve the mental health of all high school students across the country, that's vague. And it's questionable whether it would be achievable with your given evaluation resources and time frame. Similarly, research program objectives should be realistic and consider constraints on resources, personnel, cost, and time. And if possible, they should be time bound so that it's clear when the objective will be met. For instance, by September 2022, the program will train 50 teachers in how to implement the school health curriculum. So we know that by September 2022, the objective will be met. So I know I went through this quickly. Again, hopefully the program you're evaluating already has clearly defined goals and objectives, but in case it doesn't, the SMART acronym can help you to think about and identify elements of your evaluation plan that you want to measure. And there are some helpful resources online, like the Centers for Disease Control and Prevention has a 2-page guide on developing SMART objectives that we can circulate. And these are just some examples I found. I like how they present the original objective and then show how it can be made smarter. So the original objective here was staff will be trained in quality improvement. So in the middle, it says we still need to clarify the who and what to make this objective smarter. So then if we do that, the smarter objective reads as USA County Management will offer quality improvement training opportunities to staff. So it's specific, it clarifies who the staff are and what specifically they'll be providing to staff to support quality improvement. Here, the original objective was USA County Management will offer quality improvement training opportunities to staff. So here they say we can fix it by clarifying the measure and target to make this objective smarter. So then it would read, USA County Management will offer quality improvement training opportunities, resulting in 75% of staff completing quality improvement 101. So it's clear, it's quantifiable, there's a quantity provided as a means of measurement. And then finally, USA County Management will offer quality improvement training opportunities, resulting in 75% of staff completing quality improvement 101. Here, this objective looks good, but we could make it smarter by clarifying time. So you could see at the bottom, they added, resulting in 75% of staff completing quality improvement 101 by December 31st, 2019. So we know when the objective will be met. And again, there are other examples of SMART objectives you can find online, and we can circulate that guide I mentioned. And so I also understand that some of you previously attended a workshop on logic model development. So I just wanted to briefly recap here that a logic model is a diagram, usually in table format, that shows the relationship of program inputs or resources and activities to outputs, short-term, intermediate, and long-term outcomes. So it's essentially a graphic description or a roadmap that depicts the relationship between your program's activities and your program's intended effects. And again, can be a useful tool for describing a program. Here's a table that summarizes the different components. So as I said, a logic model consists of inputs or the resources that go into a program in order to perform activities and achieve desired outcomes. So inputs include things like program staffing, a budget, any materials or equipment like computers to support the program's implementation. Activities are program events undertaken to produce desired outcomes. So they reflect what you're doing in the program. For example, maybe you're holding meetings, training providers, developing a media communications campaign to raise awareness of the program and get people interested in participating. Another activity could be administering participant satisfaction surveys. Outputs are the direct, tangible results of activities, or what we get. So outputs reflect the delivery of a program's activities. For example, number of meetings held and number of providers trained, number of surveys administered to participants. So it's clear how each output has a corresponding activity. And finally, the anticipated outcomes of a program can be organized according to short-term, intermediate, and long-term outcomes. So a short-term program outcome reflects the immediate effects of a program or intervention activities. For example, you might expect to see changes in participants' health knowledge or attitudes, which you can assess via surveys as part of an evaluation. So your evaluation might be focused on assessing short-term program outcomes. An intermediate outcome reflects behavior, normative, and policy changes. So these are outcomes that usually can be measured within months or even years. For example, you might expect to see a change in clinical guidelines implemented by a health system, which can take some time. It'll take more time to measure something like that as compared to potential changes in participants' knowledge or attitudes on a topic. And then long-term outcomes are those desired results of a program that can take years to accomplish. So for example, an increase in the early detection of risk factors for a health issue among health systems. So a long-term outcome is the outcome that the program ultimately hopes to achieve. So in short, a program's SMART objectives and logic model can help you as an evaluator to complete that second step in the CDC's evaluation framework, which again is describing the program. Step 3 involves focusing the evaluation design. So after you have a firm grasp of the program, you're able to describe it, you want to address these questions. So what is the purpose of the evaluation? For instance, are you interested in describing how it's being implemented, how it's performing? Or do you want to assess its potential effects on participants? Who will use or benefit from the findings? What are the evaluation questions? What data collection methods will you use? Surveys, interviews, focus groups? What's your budget and timeline? Again, we could devote an entire session just to addressing some of these questions, but at a minimum, these are the key elements to consider in designing an evaluation question or designing an evaluation. So what makes a good evaluation question? So how you frame your question will really depend on the type of evaluation you're conducting. Similarly to SMART objectives, good evaluation questions are meaningful. They're responsive to stakeholder needs, concerns, priorities, what they're interested in learning. And the results have the potential to meaningfully inform improvements to the program. Good evaluation questions are also reasonable and appropriate. They're not grandiose or unrealistic, but they're scaled down and tangible. A question like, are our programs successful? That's too broad. What programs specifically? How are you defining success? Instead, a more reasonable question would be, do our education services raise awareness of risk factors for lung cancer among men and women who smoke? I mean, that's a bit more wordy, but that question specifies the type of services that are the focus of the evaluation, the outcome we're interested in this case, awareness of lung cancer risk factors. And that question also specified the target population, men and women who smoke. So the more specific you can be in your question, the better. It'll make it easier to measure. So good evaluation questions are measurable. They can be answered with data. So in the previous example I gave, do our education services raise awareness of risk factors for lung cancer? We could have participants as part of an evaluation complete surveys that assess their understanding of risk factors before they do the program and after they complete it to evaluate whether there's any improvement in their awareness. So that question would be feasible for us to measure. The fourth step in the evaluation process is to gather credible evidence in response to your evaluation questions by collecting data that are relevant and trustworthy, and again, involve stakeholders in defining and gathering the data that need to be collected. They often know what measures will work best with their population. I've been on evaluation teams where we want to administer surveys to program participants, and we ask our stakeholder advisory committee to review the survey first and provide input on it to make sure it can be easily understood. So data are in the form of secondary or public data in the first column and primary data. So let's say that your program aims to reduce smoking among high school students. You can consult sources in that first column, public or secondary forms of data, online that summarize the prevalence of this issue across the country and even in your state, that again describe the magnitude. So there are national data repositories. I have some examples on the next slide that hold survey data from large samples of participants that you can access for free. For example, the CDC National Center for Health Statistics. You can go to their website and access the latest data on virtually any health issue. They have data on food insecurity, infectious disease, injuries. So someone else has collected these data, but you can use them to present the bigger picture of the health issue your program is targeting and why it would be important to address. Primary data in the second column here are the data that you'll collect. For instance, in the form of surveys, interviews, and focus groups. And there are certainly pros and cons to each method. The method that you choose to collect data really depends on your question and the time and resources you have available. Generally, interviews and focus groups can take a bit longer to conduct and analyze than surveys, but they also can provide you with richer information on participants' experiences in a program, what they like about it, what they're learning, and potential areas for improvement. So I generally advocate it if it's possible to do a mix of both. Surveys and interviews or focus groups to get a well-rounded understanding of a program. And again, here are some examples of national data repositories you can consult. Again, if you're looking for statistics on a target health issue for your program. So after you've collected your data, the next step in the evaluation process is to analyze it and interpret it and justify your conclusions. I know I sound redundant, but engaging stakeholders in this step is important because there could be a result that doesn't make sense to you as an external evaluator that does make sense to them. They can also help you to understand the practical significance of the findings and what they could mean in terms of implications for action and recommendations for next steps. The sixth and final step in the process is to figure out how your findings and recommendations will be communicated. So what information do you want to communicate from your evaluation? Who do you want to communicate it to and how? Well, you can disseminate evaluation findings and recommendations in different formats. A written evaluation report is probably the most common way to disseminate evaluation results. A comprehensive report is usually provided to maybe more academic audiences and evaluation sponsors or funders who want to know the details of how the program was implemented and assessed. You can also summarize results and recommendations in something called an executive brief, which is like a 1 to 2 page summary of the program, its evaluation, and the results and recommendations. But the executive summary doesn't provide much technical detail. It's intended for audiences who just want a quick overview of the findings. You can also present your results orally, over a video, via news or press release, via social media platforms like Twitter and Facebook, which we often see, radio and television, which you tend to see less often, and via infographics. Infographics are a great way to present critical information about a program and its goals, services, and achievements, and also to present findings from an evaluation and implications for next steps. They're generally 1 to 2 pages and contain very minimal text and rely on figures and diagrams to visually convey information. This is an example of an infographic on adverse childhood experiences, or ACEs, which in this case describes the prevalence and impact of this health issue. This is another example of an infographic that talks about what schools can do to reduce food waste. So I think there's a nice balance here of text and figures that clearly convey, the magnitude or importance of this issue, and also present recommendations for schools. And this is just a final example on reducing childhood obesity. So just to give you an idea for a more visually appealing way to disseminate evaluation findings, particularly if they're going to a more lay audience who might be less concerned with the nitty-gritty details of your evaluation. And these are just some tools some of you might already be familiar with that you may find helpful. Canva and Piktochart are great for producing infographics, and I believe are free. At least the baseline package. I think you have to pay for more advanced options, but they do have free options as well. So I do realize we've covered a lot, and I'd like to take a moment to briefly recap what we just reviewed. First, we talked about how program evaluation is a systematic method for collecting and analyzing data related to the performance and or outcomes of a program. So the key word again being systematic. Whereas process evaluation is focused on how well a program works, outcome evaluation measures potential program effects on participants. And the steps in the evaluation process include engaging stakeholders, describing the program, focusing the evaluation design, gathering credible evidence, justifying the conclusions, and ensuring the use of findings and lessons learned. And as we just talked about, data collection can involve the use of secondary and or primary methods. We went over a few examples. So that concludes the first part of this session. Now, as Dr. Sneed said, we're going to break out into smaller groups to discuss how you would apply the CDC's evaluation plan template to a program you'll be evaluating, or you could apply it to this following scenario. So imagine you've been hired by the principal of a local high school to evaluate its newly implemented obesity prevention program. For the program, school health instructors engage students in workshops that teach them healthy eating habits and the benefits of physical activity. The program also includes take-home exercises that students complete with their families. So if you don't have a program that you're working on, you can use this example in your groups. And we actually went through and completed the evaluation plan template based on this example. So you have that to take with you and refer to. So yeah, this breakout session is really just an opportunity to discuss and reflect on what we covered and apply it to a program you might have plans to evaluate. And then we'll come back together and do a final quick debrief. Are there any questions, I guess, before we break up, or anything that you'd like to add, Radlisha?
I don't have anything to add. If there are no questions right now, we'll go ahead into the breakout rooms, and it'll give you an opportunity to work through the template that I think everybody should have gotten by email. For those of you who didn't get it, I'll drop a link in the breakout sessions as well. For anyone who didn't get it, just leave me a note and I'll make sure that you get one.
Okay, and how long will we be in the groups for?